Hey, this episode was filmed during the COVID pandemic, so for the safety of our cast, everyone is seated 6 feet apart. Also, this series is for information and entertainment purposes only. It isn't intended to be a substitute for professional medical advice, diagnosis, or treatment, so don't delay or disregard professional medical advice based on the information provided. And, as always, if this is a medical emergency, dial 911.
Welcome to Going to Health.
For people, from people.
So this one time...
Oh, I'm gonna go get some tasty waves, bro.
You know, doctors say it's important we keep our spines in good condition. But I've already developed a very strong backbone due to my first marriage. I was married for 10 years. 3 hours, 6 minutes, and 28 seconds. But that's a story for another show. Thank you to my two co-hosts for having my back in today's episode of Going to Health, Haley Murphy and Carlos Castro III. I would like to welcome Dr. Ray Zadet to our show today. He has more than 20 years of experience in orthopedic surgery, including complex spinal disorders. Can you tell us a little bit about your background?
Be glad to. I'm an orthopedic spine surgeon, as you said, trained kind of classically in spinal deformity correction, as well as things like removing pressure off nerves, like decompressions and that type of treatment. About 10 years ago, I became really interested in not just the surgical treatment, but also all of the non-surgical treatment. I was kind of the last person that people go to say, I've tried everything. But what is everything, right? That everything is a big bucket. So that's what got me interested in understanding that bucket, because I thought I could do my job better as a surgeon also if I understood all of the non-operative options better.
Yeah, so that's interesting. I mean, I work in the operating room, I work in surgery, and there's a lot of back surgeries that are happening. How prevalent are you seeing it in the community today?
Everybody, if you take all people, 80 to 90% chance at some point in your life that you're going to have an episode of very severe back pain. The yearly incidence is close to 20%, so that's pretty intense, as far as the prevalence. Now, the patient population, only a small portion needs surgery.
So
yeah,
Oh, go for it.
What are some of the top causes of back pain?
Oh, you just took my line.
Sorry. Snooze, you lose.
Some of it is postural. And then also it can be due to other conditions like degenerative discs, like when that happens with age, but sometimes it's symptomatic, sometimes it's not. Repetitive stress, sitting at a computer, repetitively bending, twisting, big piece that's often unrecognized is the mental, psychological, social aspect. It's not like, just the same way as when you get stressed, you blush, right? It's a physical reaction to an emotional condition, right? Same thing happens with your back, is that we kind of hold our stress and unknowingly in our core of our spine, which being our neck and our low back. So that's a very common cause of something not structurally going on with you. There's nothing wrong with you, yet you feel pain.
So what kind of patient population do you typically see in your practice today?
Well, I have my actual surgical practice is very, very honed down to a very short, small group of patients who actually have nerve impingement. But then I have a non-operative practice that deals with everything. Back pain is so multidimensional. It's, and it's kind of interesting, the similar factors that affect cardiac or pulmonary or mental health are the same conditions that affect back health.
I think that a lot of people don't know what to do. If someone hurts their back, or they wake up in the morning and there's a back pain, they don't know what to do.
Because it's also so debilitating, right? You get up and you can't move. Every movement you make, what's your natural response is, I gotta listen to my body stop moving. Your body actually thrives on activity. And to loosen it up, a lot of times the most important thing, even with about a very severe back pain, is to get up and move around.
So, yeah, one of the things that recently, in the past, everybody says use the RICE method, the rest, ice, compress, and elevate. But now I'm hearing that heat, the injury, where you're feeling that back pain or potentially your muscle or the spine. Which one is it now?
Hey, Carlos, how are you going to elevate your back?
whatever.
He's a bat. He just goes up there.
Yeah.
Just do this.
You know those reverse
Those inversion tables.
Inversion
That's what you
tables,
need, the
right?
inversion tables. Exactly.
The spine is also very different than other joints. So, for example, if you sprain your ankle or leg, right, you've had an actual injury to the ligaments and there's swelling there, and by continuing to walk on it, you're going to actually cause more damage. 99.9% of back problems are not like that. Is that there's nothing structurally going on in the back. There's something that's incited a bit of spasm in the back and the muscles, and that's what you're dealing with. So actually moving those muscles stops that spasm from occurring. So the message I want to be clear with is you want to do activity, but doesn't mean you go back to going lifting crazy things away from your body. You still have to do things ergonomically correctly. There's a couple of very high intensity exercises that are common that I see a lot of patients from, where you're doing a lot of strenuous activity with weights multiple times that include bad posture. And I've seen very young patients, 24 or 25 years old, have big disc herniations because they do it with incorrect form.
Back in my 30s, I would do squats, and I was doing it improperly. And I do remember that I think basically almost threw my back out. And I went to my physician, and he said, "Hey, you know what? You're doing it all wrong." And so I stopped doing squats for like maybe 5 to 8 years. And recently, I've gotten back into it. But I was working with a trainer, and he kind of showed me the way you're supposed to do it. So. Yeah, but it's like I said, but I definitely don't do the heavy lifting like I used to. But it's all about form.
Which comes to my next point. It's really important to have good core musculature because those discs can take a lot more the more postural support you have from your muscles.
Do you see more problems with children now because kids are sitting at the computer, they're leaning over? Is that more prevalent now?
Very much. I have 4 kids, and I am the biggest hound on posture in the house. Your head weighs about 12 pounds if it's properly positioned on your shoulders. As you start,
We're all sitting up straight
Right now.
as you talk.
as you start
Yeah.
bending forward, your joints and discs start seeing more and more stress to the point where that head effectively can weigh up to 60 pounds.
Especially right now, a lot of us now are being displaced and working from home. And I've even noticed that, posture was really important for me. I had an ergonomic station at work, and now I'm at home and I'm on a dining room table, and I'm noticing now that my posture's kind of like.
Yeah, you don't need necessarily the couple $1,000 ergonomic chair.
I love my Arion chair. That thing was amazing.
Good. I have some swampland to sell you too.
But what about those things that you can buy where, when you start leaning forward, they vibrate to remind you to stand up straight? Do those work?
Anything that reminds you to change posture is good. Your body has a certain cone of efficiency that it works the best in. And it takes a lot more energy to walk in a forward stoop posture than straight up. And so you tire out quicker. It's just like, like the Leaning Tower of Pisa. Straight up, there's not much stress on it. As soon as it starts leaning, it's going to lean more and more and more over time because more gravity is going to affect it.
Right.
So you just got to be cognizant of this starting in your teens and 20s.